Hello, and thank you for your interest in Loyola Medicine's Obstetrics and Gynecology Residency training program. I know that the interview season can be a long process, so I want to take a few minutes to remind you about some of the highlights of Loyola's program. Loyola Medicine is a nationally recognized leader in healthcare, education, and research. Its main campus, Loyola University Medical Center, is one of the nation's leading academic medical centers and a major center for tertiary referrals from Illinois and surrounding states. The medical center's 547-bed hospital is located in Maywood, Illinois, just west of Chicago. The Maywood campus also includes an outpatient center, the Cardinal Bernardine Cancer Center, home to our Gynecologic Oncology Division, the $137 million Center for Translational Research and Education, Stritch School of Medicine, with a state-of-the-art skills center, and Marcella Niehoff School of Nursing, equipped with an innovative virtual hospital. Loyola Medicine also includes Gottlieb Memorial Hospital and McNeil Hospital in the near western suburbs and locations throughout the region that offer primary and specialty care. Loyola Medicine is a member of Trinity Health, one of the nation's largest health systems. The goal of our program is to train academic leaders in obstetrics and gynecology to advance the science of the discipline, provide meaningful education, and outstanding clinical care. Our department prides itself on bedside teaching by our full-time faculty. Patient-oriented teaching rounds takes place daily on major clinical services, as well as informal teaching in the operating room, labor and delivery, and outpatient settings. During the four-year program, residency rotations focus on benign gynecology, which manages patients requiring preventative, diagnostic, medical, or surgical care for a gynecological condition. This service includes exposure to the Veterans Hospital Ambulatory Clinic, a chronic pelvic pain clinic, and an adolescent and pediatric gynecological clinic. The Gynecologic Oncology rotation offers education about multidisciplinary care for the oncology patient, and residents are exposed to radical procedures, minimally invasive procedures, chemotherapy, radiation therapy, and breast management. The General Obstetrics rotation and the Maternal Fetal Medicine rotation provide education about antepartum, intrapartum, and postpartum care for women. Residents are exposed to genetics, sonography, vaginal and operative delivery, and a wide variety of antepartum complications. Residents also gain extensive experience in high-risk obstetrics, including a variety of medical maternal complications and perinatal genetic diagnoses, as well as critical care of complex perinatal issues. Loyola residents also have access to our Level 3 Perinatal Center, which offers the latest technology, therapies, and techniques, and serves as a national model for specialized protocols and practices in the care of premature infants. Because at Loyola we have the ability to care for very premature and sick infants, we are a referral center for extremely complicated pregnancies. Another key feature of our program is a comprehensive family planning rotation made possible through a partnership with the University of Illinois at Chicago. The Reproductive Endocrinology and Infertility rotation offers training in diagnosing and managing menstrual and endocrine disorders and issues related to infertility. During the Female Pelvic Medicine and Reconstructive Surgery rotation, residents work with faculty to acquire the skills necessary to evaluate and treat women with pelvic floor disorders. They also have exposure to Loyola's Comprehensive Pelvic Floor Center, which takes a multidisciplinary approach to managing complex pelvic floor cases. Loyola is considered one of the leading sites for robotic and laparoscopic surgery, and we are a referral center for complex gynecological complications in the Chicago area. The robotics and laparoscopic training allows residents to become proficient in minimally invasive gynecologic procedures through a surgical skills curriculum and the use of high-fidelity robotic simulators. The Clinical Research Education Study Teams program, or CREST, is one of our most unique and exciting features because during this program, residents are mentored on how to conduct research and publish their work during the program. Residents work together as a research team to achieve high-quality research. This curriculum has been published in Obstetrics and Gynecology and replicated in many other residency programs in various specialties. A series of formal lectures, informal seminars, conferences, and journal clubs also add to the curriculum and prepare residents for their board exams. Wednesdays from 8 o'clock to noon are designated for formal protected resident education. In addition, each week in Patient Care Conference, patient management problems from the previous week are discussed. Residents review the cases from their service and do preliminary reading regarding those particular problems. During interactive discussions, residents are called upon to discuss basic science and clinical management issues related to specific cases. Our program also emphasizes excellence in teaching, both on the part of our dedicated faculty and our residents. We provide formal instruction to our residents to help them to become strong teachers to our medical students and provide additional formal mentorship to those planning academic careers. In addition to excellence in patient care and research, Loyola has a strong commitment to service. The Jesuit tradition of education and service permeates the Loyola culture with a rich array of volunteer and medical mission opportunities available for resident participation. We also offer specialized training for those interested in global health care with a longitudinal global and community health curriculum, which culminates in a rotation in Guyana in South America. In Guyana, residents work side by side with doctors at Georgetown Hospital to take care of patients in a resource-poor setting. Although residency is busy, there is arguably no better city to enjoy your time off than Chicago. With championship sports teams, dozens of cultural institutions and museums, more than 250 theaters, over 7,000 restaurants, and 26 miles of lakefront, there is always a new experience waiting for you. Here at Loyola, we seek residents who thrive as part of a team in an academic setting, demonstrate intellectual curiosity, strive to deliver patient-centered care, and show a desire and a commitment to teaching and lifelong learning. We are proud of our educational opportunities and resources that we feel will train and equip you to either begin practicing as a general OBGYN or to pursue additional training through a fellowship program. So thank you again for your interest in Loyola's Obstetrics and Gynecology Residency Training Program. We are excited that you are considering our institution, and we wish you the best of luck in the match process.